Hello, everyone. I'm Sandra Levy, Senior Editor of Drugstore News. Today we have with us David Snow. He's founder, chairman, and CEO of Cedargate Technologies. Hi, David. Thank you for joining us today.
Thanks, Sandy. Glad to be here.
Great, of course. So let's get right into it. Value-based care is changing the way healthcare is being delivered and paid for in the U.S. Can you discuss what are some of the challenges inherent in delivering value-based care?
There are lots of challenges. I would say that for providers, there's a very large learning curve. It's hard to learn how to manage risk when you're used to fee for service for decades. So that's number one. But the good news is there are technologies that can help individuals manage risk better and be successful in a value-based care environment. I'd also tell you that it's hard to get providers to make the journey in value-based care, meaning they're afraid of it. They're afraid of the risk. They don't know that world, and they're afraid that they will do poorly. So, what you often find is people start with programs that are called upside only, meaning there's no downside risk, but there's upside. As they learn to get to manage risk better and they get more confidence in their ability, they're attracted to taking downside risk because the upside rewards are better as you take downside risk. So, what we focus on is helping customers, our customers, move along the value-based care continuum from upside only contracts, whether they be primary care attribution or even bundled relationships, all the way out to global capitation when you're taking serious risk. It's a journey. No one should expect to be great at it day one. There's a learning curve, and people just have to acknowledge that.
Well, so a learning curve, risks, there are a lot of challenges. So can you tell me, how is technology leading the transformation from fee-for-service to value-based care and helping to support the payers, the providers, and the employers to excel at value-based care and get paid?
So I have to digress a minute and tell you that back in the 1980s, I worked for a managed care company called US Healthcare, and we were capitating delivery systems. We were doing bundled programs. Primary care attribution was very common, but there was a problem back then. And that is that the technology really didn't support the value-based care play. If you remember back in the 1980s, we still had green screen computers and floppy disks for data. That's just inadequate. There's enormous amounts of data that you have to process to get the insights you need to be good at value-based care. So flash forward to today, analytics, payment technologies, care management, they're all supporting this value-based care movement. What we've done at Cedargate is put them on a single platform, fully integrated over a single data lake, a single source of truth, so that it's less expensive, but you also get answers that always tick and tie across your platform. So today the technology is available. Now it's just about teaching those who are taking risk for the healthcare dollar to use it. And by the way, it's not just providers. Payers use our technology, and so do self-insured employers. And the people who serve those self-insured employers use our technology to garner the insights to deliver it to those self-insured employers. What can they do to better spend every dollar in terms of cost and quality? That's the goal. How do they optimize every dollar they spend? And that's where the technology comes in.
Yeah, cost is so important today, and quality, of course, is extremely important. So can you tell me then, how is Cedargate Technologies specifically improving efficiencies in healthcare delivery?
Well, we basically have significant platforms. So on this platform, we have what is called value-based care analytics, a lot of actuarial and underwriting math to help you understand relative performance of delivery systems on a risk-adjusted basis. So that's for high performance referrals. It's also to improve those who perform poorly, have them move closer to the mean of the marketplace. So if you think about it in terms of bell curves, our analytics take vast amounts of data and look at relative performance of physicians and delivery systems for specific episodes of care, whether it be a total knee replacement, a cardiovascular operation. We basically can look on a risk-adjusted basis at how physicians perform, and we can show what makes them perform to the right of the mean, which is poor performance, or what makes them consistently on significant numbers of cases perform to the left of the mean. You know, is it readmission rate? Is it avoidable complication rate? Is it unnecessary emergency room visits tied to lack of proactive care for chronic or complex problems? You can see all these things in the data, and you can see the patterns, and you're really looking for patterns. And you're not looking at unit price either, by the way. It does you no good to understand what a specific physician charges for something when it's a surgery and there's a hospital involved, there's anesthesia involved, there's lab involved. You need to understand end to end the entire episode of care. What does that look like over a number of cases? And you can learn an awful lot. Our analytics also help delivery systems model prospective bundles so that they can actually contract with payers in a way that works for them and also delivers high quality, low cost care. We also do contract modeling to help delivery systems understand if they do this contract, how are they likely to do? Or what is it they need to change to be successful under the rules of those contracts? Those are all just really fundamentally important things. You know, and the analogy I use is in the 1980s when we used to contract with physicians and I was a payer, they weren't getting these kinds of analytics. They didn't have this kind of data. So it was like asking a pilot to fly an airplane with a blindfold on. We had a lot of crashes back in the 1980s, a lot of lessons learned, but people are really making the journey now, and they're doing it in the right way. And it's very encouraging to see the many successes that are going on right now in the marketplace.
It seems like there's so much progress being made. That's so exciting. Yes. So that leads me to the last question. You touched upon it a bit, but how your software platform helps payers and providers help individual patients. How can they have the best health outcomes?
There are all kinds of things you do to drive strong outcomes. Population health is at a very granular patient level, where you look at basically someone who has type 2 diabetes is a good example. What are the things that patient should be doing to make certain they stay on track and stay out of the emergency room, stay out of the hospital, keep their eyesight, keep their limbs, right? There are things you should do proactively. The analytics basically look at the electronic medical record. They look at the payer claim data. They look at the pharmacy benefit data, put it all together around that patient to say, what has that patient done relative to their disease and what's missing? What are the things they should be doing? And it produces, and it sits inside the EMR for providers so that when the patient comes to the exam room, the physician can say, oh, wow, while you're here, you need to do this. I need to make this referral. You haven't been doing this well, you're non-compliant, to make sure you get gaps in care straightened out with patients and you improve their quality scores. That's really very granular at the patient level. And then the other analytics I talked about before look at the delivery system more broadly to look at those bigger patterns where really the delivery system needs to make changes in how they go about managing care. So there's a lot to be learned by everyone. The patient has things to learn. The delivery system garners the insights that help them progress and be successful in this brave new world.
Now, that's so exciting. We appreciate so much you sharing your insights and hope
Yeah,
you'll come back again another time when you have any new developments to share with us.
happy to do that. By the way, if you think about size and scale of value-based care, Cedar Gate today has 62 million lives on the platform. So value-based care is moving, and it's moving very quickly. It's not going to go away. I want to assure you of that.
Yeah, we will definitely follow up on that development. Thank you so
Okay.
much.
All right, Sandy, thank you.